mental health exists on a spectrum and requires a comprehensive approach involving the entire government and society. And instead of managing mental disorders only or solely, or largely in hospital-based settings, the aim is to bring mental health support closer to individuals' everyday environment, their homes, their workplaces, their social circles. By integrating care within the community, mental health support can be seamlessly delivered within natural social settings such as schools and workplaces, and leveraging existing social and support networks such as family, friends, and co-workers. The National Population Health Survey in 2022 reported that our residents are more willing to seek help informally from their social circle than formally from healthcare professionals. The tiered care model, this has been brought up by SPS Rahayu Mazam, it's been central part of the strategy and been discussed. I would highlight that this tiered care model is not something that we need members of the public to internalize or use as a guide to how they seek services. Someone with mental health concerns does not need to look at the strategy and ask, am I a tier 1, tier 2? That's not the point. The tiered care model is an internal way of organizing our services. It's an internal way of thinking how we will invest in the development of our services, shift the development of our professional capacity and capability, and integrate the various parts of our system with each other. But the reason we explain it, and I will now explain it, is to really make the point that we are very serious about what we want to do. We're very serious about reorganizing how we deliver our services and how we develop our capacity and our capability. And so in explaining the breadth and depth of what we're doing, I will need to explain a little bit about how the tiered care model will be developed and implemented. It will guide the delivery of our mental health services according to the severity of mental health needs and apply across a variety of settings. It serves as a framework, a foundation for strategic enhancements to our mental health ecosystem, and our overall goal is to improve access to care and mitigate an unwarranted medicalization and to reduce stigma. Because not every mental health issue needs to be addressed by a psychiatrist, just as not every medical condition needs to be treated as an inpatient by a specialist. So, as has been discussed, there'll be 4 levels of mental health support, from mental health promotion, self-help, and peer support at Tier 1 to the most intensive level of care in hospitals and by specialists' clinics at Tier 4. And so, based on the severity of symptoms, individuals can tailor care according to their needs. Individuals with severe symptoms of mental health conditions will benefit from hospital-based psychiatric and medical treatment. Those with mild to moderate symptoms are best supported by mental health practitioners in primary care and community settings. And the majority of individuals who may experience mental distress periodically without a mental illness could be best supported by peer supporters in schools or workplaces, as well as using self-help resources, including online. And overall, we aim to ensure that individuals with mental health needs receive the right support at the right time. And this reflects a more nuanced and responsive approach to mental health.